Employee snooping into patient health records is a significant yet often underestimated violation of HIPAA. It's not only illegal, but erodes trust between patients and healthcare providers. This video will help explore why employee snooping happens, the consequences of this behavior, and how healthcare organizations can effectively prevent it. By shedding light on this topic, we aim to help you safeguard patient privacy and ensure compliance with HIPAA regulations. So let's look into it. Over the years, there have been several high profile incidents of employee snooping that caught the national news attention. One notable case was in 2011 when UCLA Health System was fined $865,000 because staff accessed protected health information of two celebrities without authorization. One of the employees involved was sentenced to 4 months in federal prison. Also in 2011, three staff members and a contract nurse were terminated after snooping in the medical records of a shooting victim, that of Arizona Congresswoman Giffords. And about 2 dozen staff members were suspended after unauthorized viewing of patient records belonging to actor George Clooney at a New Jersey hospital in 2007. Such incidents highlight the prevalence of curiosity driven data breaches, which not only damage the institutional reputation but also result in hefty fines. These examples remind us of the critical need for stringent privacy protections and training in healthcare settings. Unauthorized access to medical records isn't limited to celebrities and high profile individuals. Healthcare workers have been known to snoop into the medical records of friends, colleagues, or even complete strangers just out of personal curiosity. This practice, while often thought of as harmless, is a serious breach of privacy and a violation of HIPAA rules. During our many years of healthcare compliance consulting and working in the role of outsourced privacy officer, we've seen many of these infractions. Some real life examples include three employees that worked together in a clinic, and two of them were looking into the other employee's medical record. While doing so, they noticed who their colleague had specified as an emergency contact. They both thought that she should use her mother as the emergency contact instead. So they changed the name and number of the emergency contact in the medical record without the knowledge of their coworker. Another example is when a group of hospital colleagues were going on a trip and they needed to have proof of a negative COVID-19 testing, which was done at the hospital where they all worked. The organizer of the trip felt that her fellow travelers might not get their test results in time, so she used her login credentials to look up everyone's results and print them out. And lastly, there was a woman who was part of a hospital volunteer organization that was accessing the hospital's EHR to read about the healthcare services and conditions that her neighbors in the community were receiving. She then went home to share what she learned with her husband, later admitting that it was the only reason that she became a volunteer in the first place. Organizations need to ensure that their employees understand that unauthorized access, even for seemingly benign reasons, can have severe consequences, both for the organization and the individual involved. Many healthcare employees assume that accessing their own family members' medical records is acceptable since they have system access and a personal stake in the information. However, HIPAA mandates that even healthcare workers must follow the proper procedures to access medical records, regardless of their position. Unauthorized self access or access on behalf of a family member is a violation that could lead to disciplinary action, including termination. It's vital for organizations to convey this clearly and to ensure employees understand the protocols for accessing personal or family health information. Preventing unauthorized access to electronic health records starts with establishing robust internal controls. Healthcare organizations should limit access strictly to those who need it to fulfill their roles. Conducting regular audits of EHR access logs can help identify instances of inappropriate access. Additionally, ongoing employee training programs that emphasize the importance of patient privacy and the consequences of unauthorized access are critical. A proactive approach, combining technology, auditing, and education, can drastically reduce incidents of employee snooping and protect patient trust. The consequences of unauthorized access to patient records can be severe for both the individual and the organization. Employees found snooping can face suspension, termination, or even criminal charges depending on the nature of the breach. And from an organizational perspective, HIPAA violations can lead to fines that range from the tens of thousands to millions of dollars. Beyond monetary penalties, these breaches damage trust with patients and the community, making it difficult for healthcare providers to maintain their reputation as trusted caregivers. Privacy officers are instrumental in protecting patient information. They're responsible for developing and implementing privacy policies, monitoring access to medical records, and ensuring compliance with HIPAA's broader regulations. They conduct regular audits, investigate reported breaches, and provide staff training on patient privacy. Having an effective privacy officer helps healthcare organizations stay ahead of potential violations and create a culture that prioritizes patient confidentiality. Without these proactive measures, organizations leave themselves vulnerable to compliance failures and reputational harm. Compliance isn't just about regulations, it's about fostering a culture that respects and values patient privacy. This starts with educating staff about the importance of HIPAA, not as a set of rules to follow, but as an ethical commitment to patient trust. Employees need to feel comfortable reporting potential breaches and must understand the critical nature of their role in protecting patient information. By building a culture where privacy is a shared responsibility, healthcare organizations can significantly reduce the risk of employee snooping and improve patient care. Preventing employee snooping and maintaining compliance with HIPAA regulations is an ongoing effort that requires vigilance and education. It's crucial for healthcare organizations to implement access controls, conduct regular audits, and to foster a culture that prioritizes patient privacy. By doing so, they can protect patient trust, avoid legal repercussions, and uphold their reputation as responsible healthcare providers. So let's make patient privacy a fundamental value that guides our everyday actions and keeps the well being of those we care for at the center of what we do. Remember to check out the description below this video for helpful links and more. In the meantime, give us a call, drop us an email, or come visit us on the web. And don't forget to subscribe to our channel to keep up to date on the business of healthcare. The Fox Group, serving the healthcare community since 1989.